Okay, we're good.
All right. Well, welcome everybody, and welcome to our speakers. First up, we have Paula Ryan and Erica Winter, who are community support specialists for the Mid-Hudson region of New York. And they are going to talk to us about contact tracing, how it works, and how you can be supported if you are told that you need to quarantine. You can explain anything else that you might be covering, but to me, that was the synopsis.
Okay.
Okay,
All
and we're just going to pass it over to Colette for just a moment.
Thanks an awful lot, Jennifer. I just always like to bring greetings from the county exec, George Latimer, and also from our commissioner, May Carpenter. We're really excited about the program this morning, and just look forward to getting all of this very rich information. So thanks again.
Thanks, Colette. Okay. So,
All right, I'm going to go ahead and share my screen.
Yep.
All right, is it nice and big for everybody?
Yep.
Okay,
Good.
terrific.
That's fine.
All right, welcome to the wonderful world of New York State general overview of COVID and COVID contact tracing. Thank you for that nice introduction. Again, my name is Paula Ryan, and I am a community support specialist for the Mid-Hudson region. There are 10 regions in New York State and New York City, or excuse me, that might be 7. I forget my number of regions off the top of my head. No, 10 regional councils, including New York City. Westchester is part of the Mid-Hudson. And my colleagues that are joining me today are Erica Winter and Mirka Medina, who are the outreach coordinators for this initiative for the Mid-Hudson. And I think this is a great day to be doing this, because it's almost a year to the day that this all started. And my job did not exist a year ago. And I actually wish my job didn't exist now, because it would mean that our lives were normal. But I'm proud to be doing this work and helping my fellow New Yorkers and people of the Mid-Hudson region in any way that I can. It's been a very long, hard year. And we're all still doing everything we can to stop the spread of COVID. I know this is being recorded, but I would just, anyone watching it in the future, I would advise them to sort of fact check. Again, COVID didn't exist a year ago. This job didn't exist a year ago. And so things change very quickly. So some of the information in this presentation could be out of date next month, 6 months, in a year. So that's just my qualifier. So I think we all pretty much know what COVID-19 is. It's SARS-CoV-2. It was a novel virus first identified in China, and the World Health Organization named the disease COVID-19. How does it spread? They believe it maybe came from animal to person, but now it spreads person to person through respiratory droplets when people cough, sneeze, the same way that flu or any other respiratory illnesses are spread. The evidence is not as clear, but it can be spread on touch surfaces, which is why cleaning and disinfecting is so important. What are the symptoms of COVID-19? It can look very different for a lot of different people. It can cause mild to severe respiratory illness with symptoms of fever, cough, difficulty breathing. Some people have muscle aches, pains, fatigue, loss of appetite, headache, confusion, rhinorrhea, which really just means a runny nose, sore throat, vomiting, diarrhea have also been reported, but less common. Some people have no symptoms at all and are completely asymptomatic. Older adults and people with underlying health conditions or compromised immune systems are at higher risk of developing severe illness from the virus. Symptoms of COVID-19 can begin anywhere from 2 to 14 days after exposure. When are people the most infectious? And that's a little bit why COVID is a bugger, because you can be completely fine and be infectious for up to 48 hours. So you just don't know what you could be around a lot of people and have no idea that you're infectious. You're most when you're showing symptoms, obviously you're still infectious, but people who eventually develop symptoms of COVID-19 are believed to be able to spread the virus up to 48 hours before developing any symptoms. Who's the highest risk? The research is out there: older adults, people with certain comorbidities, chronic medical conditions, high blood pressure, heart disease, diabetes, lung disease, immunosuppressed. Those folks are all at higher risk for serious illness from COVID. And the research is certainly showing out that given the socioeconomic health disparities, that there are significant racial and ethnic disparities in COVID-19 diagnoses and deaths. How can we help spread the COVID-19? I hope these are...
prevent the spread.
Prevent the spread. Thank you, Erica. I hope these are things that everybody knows, but it's always worth and bears repeating. Wash your hands often with soap and water for at least 20 seconds, especially before you've eaten. If you've gone out to the grocery store, left your home, as soon as you come home, wash your hands. Avoid touching your nose, eyes, mouth with unwashed hands. I have never in my life been so aware and realized how many times I touch my glasses, rub my eyes, rub my nose. So it's common for all of us, but it's a good habit for all of us to drop. Avoid close contact with people who are sick. Try to keep a distance of at least 6 feet between yourself and people who don't live in your household. Of course, cover your mouth and nose with a mask when around others. Cover your cough, sneezes with the tissues and discard it in a closed container. And clean frequently touched surfaces and objects. Social distancing, that's another term for this past year that never existed, but it's certainly one that now we hear all the time. And what does that mean? Don't shake hands, no hugging or kissing when greeting people. Limit your visitors. Maintain a distance of at least 6 feet from others. Avoid large gatherings. People are working from home, and it also led to closing schools and remote learning instruction for students. How do you wear the all-important face covering? Make sure that it fits properly and that it covers your nose and your mouth. Be sure to change them frequently and launder them. So, I'm sure we've all seen the different, right? There's this does not count as a face covering. This does not count as a face covering. This is a face covering.
And if it doesn't fit well, you can wear a second mask that will make it more snug around the nose, and that helps with the glasses too.
Yeah. My own personal demonstration on these, certainly these surgical throwaway ones, is it's stretchy enough. If you have a smaller face, you can easily just knot it to make the loops fit your face a little better. So change them frequently, and if it's a washable one, launder them, treat it just like any other article of used clothing. If you've worn it and it's dirty, wash it. Don't wear it the same mask the next day. Masks are not a replacement for social distancing. They're just they are appropriate for any social situation where you can't maintain distancing. The grocery store, the doctor's office. Continue to be vigilant with thorough and frequent hand washing. Practice respiratory etiquette, coughing into your elbow, cover your coughs and sneeze, and keep your face covered. How do you get tested, and can you get tested for COVID-19? Anyone can get tested. There's certainly situations where it doesn't make sense but to get tested, but they do recommend, and the Department of Health wants people to get tested. The only place to guarantee an absolute free test is through one of the state sites, And in Westchester, our state site is actually right here in New Rochelle at the Glen Island. And there are a few more, but those change. So the best number for you to have on hand if you're looking to get tested is this 888-364-3065. That is the state hotline. You can also speak to your healthcare provider about testing for COVID or other respiratory viruses, because the flu is still out there. I'm going to turn it over to Erica to talk a little bit more about the very specifics of the contact tracing initiative. So Erica, I still have control, so just
I'll tell you.
here's the other term now for this year. Next slide, please.
All right, awesome. So my name is Erica Winter, and I'm an outreach coordinator working with Paula. You can go to the next slide now. I think that's a really pretty image with the map though. So what is contact tracing? We've been hearing so much about it for the last year. It's a tool used by public health to slow the spread. It slows the spread by letting people know that they may have been exposed. It helps people who may have been exposed get tested. And it also slows because when you're reached, because you have symptoms, because you've been exposed, because you've tested positive, you're asked to either isolate or quarantine. Next slide, please.
Sorry,
Next slide.
No, I know I clicked my mouse away.
Okay.
So when I clicked my mouse away to another spot, I was just
Okay.
trying to make sure that no one else was trying to get into the meeting.
Oh, thank you. All right, so how does it work? When someone tests positive for COVID-19, the lab will notify the health department. So that means you go get tested at your private doctor. They will report to the state center, the state health department, okay? The local health department calls the person who tested positive to find out from them who they've been around in the last days when they've been contagious. Then they get in touch with the people who that person who tests positive have been around. Does that make sense? So when you test positive, they find out who you exposed to your virus, unknowingly, of course. And then they get in touch with those people and they ask those people to stay home for 10 days. Next slide, please. This information is confidential. So if someone calls you because you've tested positive for COVID and you provide contact information for the people you've been around, they are not going to tell anyone who it was that tested positive, who provided the information. And contact tracers, they will ask you for names and date of birth, but they won't ask for any bank information, any social security numbers or money, or your health insurance information. I think it's really important to point that out, okay? No one will ask you for your social security number if they are from the Department of Health. If they do, it means they are not from the Department of Health. Next slide, please. Oh, here it is again. Same thing.
It bears repeating because
Yes,
it's
it
really
really
important. It's part of the promise of the contact tracing initiative that we will never ask for social security numbers or insurance numbers.
Now, we
They
might ask for Medicare or Medicaid, not your numbers, but do you have these? Because then we know how to help you best. Anything
So
else
again,
on this slide?
if somebody's asking for a social security number or specific numbers or financial information, hang up. It is not the Department of Health.
And there are a lot of scam artists out there, unfortunately. So it's really important. All right, next slide, please. So here's an example of contact tracing. Samuel gets sick, he tests positive. The local health department will call Samuel to trace the people who have been in close contact with him. Samuel says he was in contact with Carmen. The contact tracer contacts Carmen, tell her that she may have been exposed to COVID-19. The contact tracer is not allowed to tell Carmen that Samuel may have exposed her or that Samuel gave the information, okay? The contact tracer tells Carmen that she needs to quarantine for 10 days. They will also tell her how to get tested. If after 10 days, Carmen does not have a positive test or develop symptoms, her risk of getting sick from her exposure to Samuel or her quarantine period are over. If Carmen does test positive or get sick, she will need to isolate and provide a list of her close contacts to the Department of Health.
And the beauty of contact tracing is that if Carmen has done what she was supposed to do and stayed in quarantine, it means that she doesn't have any close contacts. For her, the spread stops with her.
Yeah, next slide. So communication outreach. So New York State is educating residents about contact tracing. We're encouraging people to follow public health. And if you get a call from NYS Contact Tracing, and this number here, 518-387-9993, please answer the phone. That's how it comes in on, that's what it will show up as on your phone. So yeah, that's what we're asking people to do. Just pick up the phone, answer the call, and participate. Next slide, please. What happens if someone is diagnosed with COVID-19? A public health worker will call to check on a person's health. They will ask the person who they've been in contact with where they've spent the time while they were sick, and where they may have spread COVID-19 to others. They'll be told to stay home and to isolate if they're not already doing so. Basically, we will tell them to isolate, even if they've been doing it, just to be sure. The person should continue to monitor their health. If their symptoms worsen or become severe, they should seek medical care. A public health worker will help if a person needs support or assistance. For example, if they need food or medicine or help solving problems while they're in isolation because they can't leave the house. Anything to add to that, Paula?
No, I guess just that we're that last person, the community support specialists. We're the ones who are calling. Like once they've had, they've been identified as a case or contact and they need additional support, then they get referred to the community support person who gives them a call.
So what happens if someone is exposed to someone with COVID-19? A public health worker will call the person to inform them of the exposure. That's called being in close contact. The person should stay home and self-quarantine for 10 days, starting from the last day they were possibly exposed. The public health worker will provide the person with information about COVID-19 testing. That's the phone number, how to get tested. And they are permitted to go get tested or to seek medical help, even if they are in quarantine. A public health worker will help the person if they need support or assistance while they're in quarantine. If the person should take their temperature twice a day and notify the health department if they develop symptoms. Basically, taking your temperature helps because you might not notice that you've got a bump in your temperature unless you're actually taking your temperature. So go ahead.
I know that was my bad.
It's okay. Let's go to the next slide. So who is a close contact? If a person has been around someone with COVID-19, they may be identified as a close contact. It's a person who has been within 6 feet of a person with COVID-19 for 15 minutes or more. It's someone who has been in close contact with someone with the case, someone with direct contact to the secretions, for example, being coughed on or sneezed on. And surprisingly, we all learned that it travels very, very far. And it's someone who's been in a closed environment, like a classroom, a meeting room, a waiting room for a prolonged amount of time. Next slide, please. So what are isolation and quarantine? Isolation is for someone who is sick, someone who's tested positive for COVID-19. It means separating a person from people who do not have COVID-19. This person must stay away from others for at least 10 days after the symptoms have started or after they've tested positive. And a person who is in quarantine is someone who has been exposed. And it means separating a person who is not sick but has been exposed so they can be monitored, so they can monitor themselves. And this person must stay away from others for the 10 days to see if they get sick. And of course, if they do get sick, report the symptoms and seek medical attention as needed. Next slide, please. When to seek medical attention, emergency medical attention. There are certain warning signs that we talk about, and if you notice this in someone who's tested positive or someone you suspect has COVID, please seek medical attention immediately. That is if it's clear they're having trouble breathing, persistent pain or pressure in their chest, a new confusion, like they're not making sense, speaking gibberish, an inability to stay awake or, to wake them up. You're unable to wake someone up. Another telltale sign that something is really wrong and you should seek immediate attention is if the skin color on their face or in their nail beds changes to an unhealthy color, like a pale gray or blue colored. It depends on your skin tone. I always think of it as, how do you know when you've been in the pool too long and it's cold? There's a change in your nail beds. And you'll see it in kids, their lips turn blue sometimes or purple. And that's a definite sign that you need to seek medical attention. And you're directed to call 911 or to call ahead to your emergency facility and let them know that the person may have COVID-19. It's very important. Everyone's expecting that to be the case now, but it's important to be clear and communicate it. Next slide. So how long does it take to develop COVID-19? From exposure, it takes 2 to 14 days for a person to develop symptoms. The average is 4 to 6 days. And the 14 days is what we call the incubation period for COVID-19. A person is exposed to COVID-19, they should self-quarantine for 14 days and monitor symptoms. So the quarantine time is actually 10 days, but for the 4 remaining days of the quarantine, you're supposed to self-monitor, and if you develop symptoms, report it. Most people, I think it's only 3% will develop in those last 4 days. So that's why they reduced the time of the quarantine to 10 days. Next slide, please. So how long is someone with COVID-19 infectious? People with COVID-19 can spread the virus starting 2 days before they develop symptoms, which is so tricky. Most people are no longer infectious once it has been 10 days after their symptoms began and they're improving. They don't have a fever. So this is the infectious period, those 10 days after they develop symptoms or in 2 days before, right? If a person tests positive for COVID-19, they should self-isolate for at least 10 days after the symptoms began or the date of their positive test. Do you have anything to add to that, Paula?
Nope, but I'm sure there'll be questions.
Yeah, I think there will. Because it's confusing. It really is. Next slide, please. So for more information, this is a great sheet to grab a screenshot of and print out and keep at home. Important information to have. It's the Westchester Emergency Operations for the local health departments, the 866-588-0195. And then for the New York State Department of Health, we have a COVID hotline, 1-888-364-3065. There is a website link here for asking questions. There's one special New York State website for coronavirus. The one I think is really important is the vaccine website. Am I eligible? That's the link you click on to register for the vaccine. And there's a vaccine hotline number you can call also. There's also a vaccine fraud tip line. I think that's our last slide, right, Paula?
It is.
All right, let's unshare. A riddle, maybe?
Why, if you want a question while we're figuring this out, actually my personal experience is I had COVID, and my husband and I, once we realized I tested positive, we isolated. He's a primary care physician, so the hospital gave him his first shot. This was more than 10 days after I had my symptoms. A couple of weeks later, the day after he got his shot, or 2 days maybe, he developed pretty serious COVID symptoms, much more serious than mine. And now the question is, when does he get his second shot? And they're telling him to wait 45 days after he got the first shot. I mean, it's not a question that fortunately will not happen often, but every time you think you've heard it all, there's something new that pops up that you're not sure about. And this is something that happened at a hospital. So,
Wow. Wow. Well, I'm
Yeah.
so glad you guys are both better.
But so this is very choppy. I do apologize for the distraction. But so New York Project Hope, there's the main hotline, the 844 number that you can reach out just to test it, to see what services are offered, any type of emotional support you might be looking for. And you'll get a crisis counselor who works for OMH anywhere in the state. What FEMA did several months ago is they looked at each county and identified provider agencies that were embedded in those counties in different demographic groups. So FSW was picked and given a grant to provide New York Project Hope services because of our work with children, seniors, the whole gamut, because there's over 50 programs that our agency is embedded in the county. So the benefit of reaching out to, say, our hotline for New York Project Hope versus the main number, if you live in Westchester County, is that you would be getting a crisis counselor who's very well versed in the local resources needed to help somebody if they should need resources to be referred to further mental health services, transportation needs, food insecurities, all that. So that's one benefit. So I lead a team of 6 crisis counselors, and there's 2 other teams that FSW is working with that we also is under the FSW umbrella. And one of those is an open door team, because FSW works very closely with Open Door to provide support services around the county. So what it's not to take the place, I should be very clear to explain this. It's not long-term case management services. So it's very important to, and I get this question a lot when we're doing outreach to, different mental health providers. They ask me if this is a duplication of service. It's not. If you look at, say, your the perfect example. So if you're dealing with a school system, and we're getting referrals from different districts, from social work staff and psychologist staff, it's not necessarily just for the students that they're working with, but the families that are involved, even the staff within the school systems, the janitors, the custodial staff, the bus driver staff, the teachers, all the first responders. So this impacts everybody. So in presenting this information to you, don't just necessarily think about the clients that you serve, but anybody personally related to you, or anybody, a coworker, could easily call the hotline for help. It's very brief. Crisis counseling is brief supportive services. So it's 1 to 5 encounters with a counselor. Some of that could be linking people up to peer-led support groups if they need emotional support for other people going through similar circumstances. So we lead peer support groups for parents that are dealing with remote learning. We do senior support groups for people that are isolated. Caregiver support groups for people who might have a family member who has dementia, and their adult daycare programs are shut down now, and they're stressed out because their loved one is home all the time because they can't send them to the daycare. So we really run the gamut. We do educational support, educational presentation groups to different medical practices, and all sorts of professionals. We're embedded in a lot of AA meetings around the county. offering services there. So we've presented at various AA meetings. We've been invited. We have several of our 18 crisis counselors are also KSAC certified as well. So they're able to provide drug and alcohol counseling services as well. The other important thing to mention is that all of the counselors are trained by OMH. We had to go through extensive training, no matter what our degrees are in, to provide specific crisis counseling services. We have more than half of our staff are bilingual in Spanish, and we have several French-speaking counselors as well. So that would be the, I guess, the gist of it. I'm sorry I got a little distracted with the volume issue, you know, a perfect example with, I'm listening to Paula and Erica talk. My children have been contact traced several times through the school system. So I get that. I understand how that works. So, and in speaking with different contact tracers when they give the call, you know, we're a great resource for you guys when you're dealing with a family member who seems a little stressed. And I know you do give resources out there, but our crisis counselors are trained to provide a little bit more extensive, you know, counseling support services over the course of 5 interactions. So we could be a good resource for you as well. And that's pretty much the gist of it, Deb. I can share, I should put together, everything has to be approved, and it's a lot of red tape. Before I can use a PowerPoint presentation or anything, I have to submit it for approval. And everything has to go through OMH, and not everything works entirely super fast for that approval. So I should work on getting my game together a little bit better for that. So you guys were great, Erica and Paul. I really appreciated your PowerPoint. And I can share in the chat right now with everyone the website and the FSW hotline number for referrals. The best way, honestly, this is completely anonymous. We're not collecting any data on people. We cannot even ask them their name if they don't want to give it to us. We do ask their zip code if they're willing to give us that, because that helps, especially with resources. So say if somebody has a food insecurity, we don't want to be linking them up to a food pantry in Peekskill if they live in Yonkers. So things like that are important if they're willing to give us that information. So the best way is to just share the hotline and the website info with people and have them reach out directly to us. But if they do ask you as a professional and they say, well, I'd appreciate if you just tell them to give me a call. All we need is a phone number. I don't want any other information. And this is something we're running into with internal agency referrals from, you know, because of just the nature of it. So like social work staff from the early intervention program at FSW would give me the whole case history of somebody. I don't really want that information. I'm not supposed to know that information. So we would be calling that phone number and just letting them know that we, you know, we can tell them that we're affiliated with FSW. So if it's like coming through our agency, they would understand that. But we could say that, you know, what we do say is that we, you know, we work with New York Project Hope, and we're here to provide information and support around the pandemic. Is there anyone in the household that's been impacted that possibly would like to speak to us? It's free, anonymous, and we're here to help. And if they don't want to speak, we're not telemarketers. We're not going through a phone book, just calling everybody. So that would be how a referral would work if someone asked you to have us reach out to them. So.
All right.
Okay.
Wow, that was great. Thank you.
Okay.
That's great, Maggie. We're in the same boat, and we have to. We didn't create that slideshow. We were asked that, like, this is the one that we're, you know, that we can use.
Yeah, I have the generic stuff, and I can use some of it, but to tailor it to, it's so silly. I guess I could say it. This is a very small call, but it's fine. People can call the 844 number, and that's great. They link them up to services and give them emotional support. But each agency that has a contract is vying for being able to help people. So I'm trying to get approval to have it tailored. So our hotline number is out there and everything. But I'm about to share the main website, which has all the state information. And then I'll put our hotline phone number in there, and as well as my email address and phone number. But I'd love to connect outside of this with Erica and Paula.
Oh, you're now on my list, believe me.
I think I already have a referral for you too.
Yeah, right when we hang up, yeah.
Great.
So, I was actually just hearing you guys talk, and for me, I had a question too, like Maggie, you're talking about how much support you offer for people throughout the pandemic. Paula and Erica, I know that contact tracing team also offers support. The way I first met you, Paula, met you by phone anyway, was that you were looking for ways, because of my affiliation with Connect, that we could get food to people who are quarantining or in isolation. And was wondering if you could share a little bit more about that, about what, once people are identified and asked to quarantine or isolate, kinds of
we have referrals for that.
What's that?
Yeah.
So
Well,
after that, like, are you guys involved? I know you're involved somewhat with the food distribution, because I know that's how I met you. So if you could speak a little bit more to that, that would be great.
Sure. Well, as part of the contact tracing interview, they're asked one question: are there any, barriers? Do you have any food, social service, or medicine needs that would prevent you from successfully staying at home? Because that is our one goal. If you are a case or a contact, our goal is to keep you at home. And so if they answer in the affirmative that they need help, then they get referred over to the community support specialist. And the number one need is certainly food and food insecurity. And part of our role is also to vet whether that person can actually afford food on their own. So much has changed, and availability of delivery services has ramped up, that if people have the financial wherewithal, then we help. And some people still just don't understand. So we will walk them through that, trying to understand how to do that. For seniors, Instacart has actually specifically set up a senior line. They still have to have someone set up the account for them, because it involves a credit card number. So the community support staff can't do that. But if they have a friend or relative who's willing to set up the account for them, then the senior just needs to call the Instacart phone number, and they will help them walk them through an order. So it's things like that. And if there is there's a financial need, I can't work, I'm already on, food stamps. We then can walk them through which organizations actually, which grocery stores accept food stamps online. You can use your EBT card online. And if, we're still trying to figure out how to meet the food need, then we refer to the local pantries. Westchester is uniquely set up in terms of assisting that it's their residents, for the most needy residents. Family Services of Westchester, which I know is not you, but it's another branch of Family Services, does provide wraparound services and can deliver food. And we also have a really wonderful organization that's community-based, Hillside Food Outreach, which has been delivering groceries all along to people. And so we often refer to them to help people get food. And we do let people know there's no, we joke, New York City does us a little bit of a disservice with their radio ads about what they can provide, because every county does something a little different. So in Westchester, in terms of food delivery, it's either from Family Services, which is prepared meals, or local. We try to find the most hyper-local pantry. And if we can't find a hyper-local pantry, then we'll reach out to Hillside Food Outreach. And they deliver, my son delivers for them. It's people think food pantry food, it's a box of cans. That's not what it is. They really do a beautiful job of trying to provide nutritious food, fresh, whatever fresh produce they have available, milk, eggs, as well as shelf-stable foods. So that was a very long answer to your question. Did I get it all in there?
Okay, sounds good. Great. So Louise,
Any other
Open chat.
questions? I have one quick question for Maggie. So my question is, do you also deal with, does Tonya work with you with her with her project, and you work with other agencies as well?
Yes. Yeah.
So if somebody calls and they have, either they or a relative or a friend needs really long-term support, how would you handle that?
So we're in initial steps. So you can refer to us for, you just come across somebody and you think that, wow, they've had a lot going on. Like, you're a perfect example, Louise. You can start with calling us, and in dealing with our crisis counselors, part of what the training was is to identify, okay, this is not long-term case management. So this is, let's identify what their physical needs are. Obviously, first, do they need food? Do they need, help with anything related to isolating if they're COVID positive? And then start to delve into a little bit about the emotional support and de-stressing techniques. And very, very quickly, and that's part of the reason why we're not supposed to be having encounters more than 5 interactions with somebody, is to recognize when they need more help and to refer out for that help. Having said that, so you asked me about Tony Amonte, who just for others on the call is works at FSW too, in some of our senior programs. So she has referred and can refer to us. For other services, it could be related to the person they're working with and or a family member associated with that person. And we then sometimes referred back to their own program or to outside agency programs. So this is not just an internal FSW program by any means. I see Kitty on the call. I mean, I give out information all the time, about West Fair rides, as well as Ride Connect, as well as Paratrans. I mean, everything. It runs the gamut. And we're not supposed to be plugging any one service. Having said that, yes, FSW does have their own pandemic support program, which is wonderful for newly diagnosed people, and they're a great resource. I would be lost without Jean PC's weekly emails for the updated food pantry list. So they're a great resource. And our crisis, with the beauty of this, which is great, is that there's 22 people on staff for just our crisis counseling program in Westchester. And I should be, very truthful and honest that the library system has their own contract to provide near Project Hope services in Westchester. So does Empress Ambulette Service. So does, I think there's 6 contracts in total. I think Mount Vernon Neighborhood Health Clinic has one too. Obviously our Open Door affiliation. So they're kind of feeding them their own clients through the people that come in for help to their clinics, virtual or in person. We're all working as a team here. And we take a lot of internal referrals, but all the networking and outreach is being done. Individual crisis counselors, when they're not answering referral calls, they're doing their own outreach. So it's been pretty amazing. I mean, I had 3 of my own crisis counselors yesterday that didn't have a heavy caseload, and they're very comfortable with in-person outreach, and they were outside the DSS offices in Yonkers and White Plains handing out flyers to people. They were at unemployment in both those locations. They went to the courthouses and handed out information. They were in the homeless shelters in South Yonkers at the YWCA and the YMCA. So we are literally on the street and doing it virtual too. And so I don't know how all the other county New York Project Hope contracts are rolling out, but I'm just letting you know how FSW's program is rolling out. So, this is not going to be around forever, hopefully, the same as the pandemic, I think, as Paula had said. I'm a geriatric social worker by training. I was not doing this, up until December. This is completely new to me. My whole life was geriatric for nearly 20 years. And now I'm dealing with a complete mixed bag on, you know, children's needs, addiction recovery needs, like, you know, so it's, you know, the training through OMH was great. And it's, you know, people from all walks of life are crisis counselors, and it's a great program. And like I said, it's here, Louise, it's a Band-Aid to help people, link them to source resources. And hopefully when this pandemic is gone away and all of us will go back to whatever type of work we were doing before or something different.
Thank you. Thank you, Maggie. Do we have any other questions?
Yes, this is Linda. I do have a question. What, when you are doing contact tracing and you're advising someone to quarantine for 10 days, how do you handle someone who says, I have to go to work?
Well, it depends on, first, you know, we find out if they're an essential worker, and you know, that is important to know. And they have different criteria of how essential workers quarantine, which is basically if the local health department and the employer agrees this is indeed an essential worker and we need them there, the person's allowed to go to work, but needs to stay home the rest of the time. If a person says they need to go to work who is not an essential worker, we talk to them about it. We explain the importance of staying home and explain everything to them. And usually a person will then agree to stay home. And that, you know, that was my experience when I was contact tracing. Paula, do you have anything to add to that?
It's part of the conversation because nothing about this contact tracing initiative is, nobody wants to be punitive. It's all about social responsibility and talking with people about, okay, so what are the barriers to staying home? How can we help you understand your social responsibility, and how can we help you solve the barriers? Is it food? Okay, let's help you figure that out. Is it your employer is insisting that even, you know, your job at Dunkin' Donuts makes you an essential worker? Trying to coach people through having a little more social capital to give a little pushback and say, like, you know, that is actually not true. A Dunkin' Donuts worker is not an essential worker. Giving people the information to, you know, Department of Labor, here's this information, here's the information on the paid sick leave and what you need to do. And I'm often surprised at how employers don't say anything and people are not aware of the benefits that they're entitled to. So we do our very best to talk them through what's behind the question or the refusal, and can we help them figure out any of the barriers? Are we reaching through the phone to, you know, no, that's not the way any of this contact tracing initiative works. It's based on social responsibility and, you know, caring for each other. Putting the care of the community above the care of the individual. Yes.
I actually had a quick question for you guys.
Yep.
I'm trying to word it right because I can understand what's going on. So in one of the contact tracing incidents with my kids, the principal called me to say, the first call I got was from the school to say, look, you know, 2 of your kids were exposed. I put the math together and figured out it must have been the gym teacher, because that would be the only connection on why, you know, why both of them were contact traced and the gym teacher was missing for a few days. So, and they said I would hear from the state. What is it took a long time. I actually didn't hear from the state until the 10th day, but this was about a month and a half ago. Has that sped up more? Is that, yes. I know they were.
It's certainly not the goal. That's not the goal. The goal is to have a response time much faster.
Okay.
Given the surge that we saw, many health departments were completely overrun. We do have part of the contact tracing initiative. There's also school specialists that work with the schools to try and help lift the burden of the school administrators to sort of figure out who needs to be called, who, you know, who's actually virtual and so many kids are virtual. Like the school just provides a list of here's the gym class, and who's virtual, who's not virtual, who actually was there, who was not. It gets very complicated. So they absolutely work as fast as they can. Is 10 days the goal? No.
No, I know. I mean, I knew because the principal called me and you talk about social responsibility. So I knew, okay, well, they're not going to school, obviously. They shouldn't my son didn't go to soccer. My daughter didn't go to swim. Like, I understood that, but I kept waiting every time my house phone rang, and it was, the contact tracer was very funny on the phone. He goes, they have to quarantine until, tonight. He was very funny about it, and he apologized profusely, and he even texted me the next day just to check it again. He was great, but it was kind of a comical routine. I mean, but yeah, the social responsibility is important. I knew because the school told me. So yeah, I can understand. I was just wondering but that was after Christmas, so I'm sure the surge was greater. Yeah.
It was tough. It was, we're in certainly this Westchester and every state or every county in the state is in a much better position right now. I mean, the gold standard is really, I think 24 hours for cases and 48 hours for contacts. And that is off the top of my head in terms of the gold standard, but I believe that is what it is.
You know what I think part of the problem is, especially with schools, there's medically, there's one thing, might make sense medically, but it's also dealing with emotions. And if people don't feel safe, no matter what you do, you're not going to get them back to schools. And as someone who worked in the schools for many, many, many years, my belief is once the vaccinations are opened up and easier to get, that people will feel better about sending their kids to school, and teachers will feel better because as I said, it's one thing to say this is what you need medically, but there's also an emotional part of it, and that can only be dealt with by making people feel comfortable in their environment.
I have to say, Louise, and I know this from having a teenager, she doesn't have a fear of COVID. She has a fear of contact tracing, because if she gets caught for contact tracing, her sport is back up and operating again. That would just devastate her, that she would have to miss 10 days of practice. And that's interesting. So it's interesting. This is probably a whole nother Zoom and a whole nother audience, but the mental health piece on the contact tracing alone, not even getting the virus.
Right.
Yes, getting that call. Yeah, if you see that caller ID, it's upsetting.
Yeah.
If you're a case, I feel like if someone who's a case, they know, like they've gone and gotten a test. They know there's a 50% chance they could get a call saying that they're or get but the contact tracing, it can come out of absolutely anywhere.
Yeah.
And it's hard. And we give out the emotional support hotline all the time. So I absolutely would love to talk to you, because I did not know that there was one specific to Westchester.
Yeah, well, that's the whole state now. So like if you're servicing Dutchess County, there's providers up there. The way FEMA and OMH did that, so they would start getting more specific like resource help based off of exactly where these people are living. Which is smart when you think about it that way. And it also offloaded the heavy load of responsibility for the 844 number for staffing by OMH.
All right, are there other questions before we close out? Deb, do you want to say anything?
I have nothing to say other than thank you so much. I mean, this was
absolutely.
And I mean, I think so great that we even got Maggie connected up with
I know. I owe you, Deb. This
Erica,
was
and Paula.
in a few weeks.
So it's all
The
about
information,
right?
But the information's been great. I did not know as much about the contact tracing as I know now. And Maggie, you're going to be talking to my Rotary group on the 23rd, I believe.
Yes.
And Deb, if you want to chime in at that group and talk about Ride Connect, you're welcome to do that.
All right, we'll take that offline. So thank you so much, everybody, for coming today. And stay safe out there. Thanks.
Colette, could I trouble you to stop recording and then maybe I could speak to Maggie for a moment?
Absolutely. I'm going to do
Thank
it
you.
now.
Okay.
Okay.